Loosh,
Ibby.
and you.
And you.
It's the cool cousins. Welcome back, ladies and gentlemen. It's good to have you. It's good to have you. The cousins, the family. It's like a family reunion. You know when the family gets together and the cousins kind of run upstairs?
Oh, yeah.
To go chill?
To go chill.
Or they run down to the basement. That's how I feel every time I say what's up and
Yeah.
we're back in the building.
Yep. All day, bro. Go upstairs to purposely shit disturb.
Yeah, I mean, you knew there's like cool aunts, cool uncles that like you knew, oh, yes, we're heading to their house.
That evil look comes up, you know what I mean?
Yeah, it's on.
Yeah.
That's a good feeling, man, when you're with your cousins. I like that. We have been talking a lot about COVID, the pandemic, and the lockdowns. At length now, when you ask me, Loosh, Ibby, what is the point of the podcast? I would say, well, it's to be with your cool cousins and to talk shit and to gossip and relationship advice. We talk about religion. We talk about the Arab culture. We talk about everything, but also we talk about the things that are on our minds.
Yes.
And that is occupying a large place in our hearts and minds. And,
Of course.
And the lockdowns have affected us personally. And it's affected a lot of people professionally and emotionally. And so I felt like the conversation should just continue organically.
Yeah.
You know?
And things keep rising too, right? Things keep popping up.
Yeah. And from the beginning, I always said to myself, no matter what happens, we have to make sure we put the people that are standing in front of us first. The selfless frontline workers that have made it their careers, that have made it their job to wake up every morning and be selfless. These are the people we need to prioritize. These are the people we need to defend. These are the people we need to protect. Without the frontline workers, we're done.
Yeah. And from the bottom of my heart, thank you to every single one of you, honestly.
Those are the people that execute, that do their jobs and they walk away.
Exactly.
Expecting nothing in return. So I said, listen, all right, we've done an episode already. We're talking about politicians, Ibby. We're talking about social media. We're talking about Andrew Schulz and Alex Jones. We're talking about Doug Ford and Trudeau.
Oui, boys.
We're talking about social media and the guy with the big teeth and the neck tattoo. I forgot his name. Sky something. Okay, that's fine. It's all a part of the ecosystem. We're a part of it too. We're a couple of goofballs that are just talking about things that are affecting us, right?
Yeah.
Now it's time for everybody to shut the fuck up, and we need to listen to the frontline workers.
I couldn't agree more. Because they are the ones that deal with COVID firsthand.
And they are the ones that have no horse in this race.
Zero.
They are the ones that actually are sacrificing their health and well-being for the sake of public good. So, and some would argue, well, it's their job too. They signed up for it and everything. But at the same time, your job says a lot about you.
Of course.
So I connected with a registered nurse from one of the intensive care units in the city, one of the largest hospitals in our city. Intensive care unit, you're going to hear us mention ICU. That stands for intensive care unit. Intensive care unit is no joke. Have you ever been in the ICU?
No, but I've had a couple people close to me who have.
Yeah.
Doesn't look pretty. So basically ICU or intensive care unit is the part of the hospital where you don't want to be in because that means you are severely, severely injured or close to death.
Yes, that's right. I've been in the ICU. I was in the ICU for 7 days following an operation of mine. Not necessarily close to death, but you are the most at-risk member of the hospital or patient that is in need of the most care. Because every ICU patient is assigned a specialized ICU nurse. And when you think ICU nurse or doctor, that is the crème de la crème. They are at the top. I remember I fell in love with my nurse. I was so drugged. And I was healing and I was emotional and I was going through so much. And my nurse had the biggest blue eyes. I never saw her face because she always had a mask on, but she had the biggest blue eyes and she was taking care of me every day. I had one button. I got to see her face. You know what I mean? Of course, she had to come and like give me a sponge bath sometimes.
Yeah.
Like ICU is you're very much indisposed. You're not able to tend to yourself properly.
Yeah.
And there's a button there and you're like, I remember the rooms, there's one desk and each nurse sits in it and all of the rooms, it looks like a kind of like an octagon or like a circle. And as soon as the button goes, the light goes, a nurse runs into the room.
Just that thought of you explaining it and why you have to be in the ICU should just show everybody how experienced and skilled you have to be a nurse in that area.
They are the kindest, sweetest, most selfless human beings you can find.
It's not for everybody. Like you have to have a certain mindset for it too.
Oh, you got to be strong.
Oh my God.
You have to be tough as nails. And, and we're talking with people that are recovering from a massive procedure or are suffering from a very, very severe disease or condition. And they're not always in the mood. The drugs may do something. The treatment may be affecting them in some way. Think about all the personalities and moods that you can encounter in an ICU unit, tough as nails. So I said, we need to hear from them. And I connected with a registered nurse from one of the ICUs in Ottawa. And I had some questions and I asked them because I said, you know what, like I mentioned, we need to shut the fuck up. Everybody needs to stop talking because we need to hear more from these people.
Yeah, it's time to stop guessing and making it sound like you know what you're talking about and just let the real people who know who they're talking about speak.
I mean, at the end of the day, we only spoke based off of our own,
experiences, opinions, and the whole nine.
Yeah. From a business perspective, like we vented.
Yeah.
It's a year and a half of lockdown. We went in. Now, were we always factually correct? Did we have sources? Blah blah blah. Like, no, we didn't. But we were just two human beings, tax-paying residents of this city and this country, and we were just expressing ourselves. But now that I read over the answers that this registered ICU nurse gave me, it really opened my eyes to a lot of things. And it really made me realize like, I need to shut the fuck up a little bit.
Yeah. It does open your eyes.
The politicians can be dirty. The businesses are being affected. Families, there's a huge mental health angle. I think that's what we were talking about more: alcoholism, drug use, divorce, and all that stuff. But when you're talking to somebody that's living it in the ICU, bro, I'm going to run through the questions and I will give you their answer for the sake of their privacy. We're not going to mention who they are. And there's a couple of pictures that they sent me also for the sake of their privacy and confidentiality. I'm going to just describe one of the pictures. There's another picture that I'm allowed to show, which was showing the vaccine rates that they posted in their staff room. But this is going to really give us a good indication of what they're living and some of the things that we as a society are actually being shielded from, like from them. Like they're dealing with so much shit that we just don't know about.
Of course. Always. Just because you don't know about it doesn't mean it's not there.
The first question was, can you describe the reality in the hospital and ICU unit? Many people don't see full waiting rooms, and the perception is that case numbers are being inflated. This person wrote, the hospitals here are filling up. Working in ICU, I'm not sure about what the emergency room waiting rooms and what wait times are like, but our inpatient units, admitted patient areas are filling up. The ICU specifically has opened up more beds than we normally have by fitting more beds in each room. So technically we aren't full in brackets yet, but the number of patients in there is higher than we normally hold. A lot of these COVID patients are transferred over from the Toronto area. It sounds great that we aren't full, but we are struggling to staff these beds. The hospital has been very supportive on frontline staff and helping out whenever we need it, but by sending us more nurses to help. But the issue is ICU needs specially trained staff. So these nurses they're sending can only do so much. Never thought of that.
Me neither.
Each ICU nurse typically has one ICU patient to one nurse, but now most ICU nurses are doubled with 2 ICU patients and have a buddy, so non-ICU trained nurse, to help them out in any way they can. Basically, although the hospitals in Ottawa aren't bursting like they are in Toronto, the ICU is starting to fill up with those Toronto patients, and the front staff here in Ottawa are starting to feel the pressure daily. I have a friend that works in Kingston Hospital ICU, and they typically carry 32-ish patients in their ICU, and now they have 66. Majority of these patients are Toronto patients requiring ICU, and now they're coming here to Ottawa. It's only a matter of time before we are way over our capacity too. So that was something that really opened up my eyes.
Wow.
In terms of transferring, right? Like this is a provincial conversation, not just a city one.
Yeah, because it also makes me think now, with everybody saying our hospitals are flooded, we need to shut Ottawa down. Now, is it from Ottawa or is it from Toronto? Are hospitals stacked from Toronto? I'm not saying most, like the entire hospital, but I'm guessing, like I'm trying to wonder if it's the majority of the ICU.
It sounds like it. It sounds like it. It sounds like the hot spots are in Toronto, and they're relocating them.
I'm not gonna say this hasn't been talked about in the media at all, but I definitely have not heard about this.
Me neither. I haven't heard about it at all.
This is my first time hearing that there are Toronto patients being transferred from Toronto to Ottawa.
Yeah.
And nobody's talking about it.
Yeah. I mean, redistribution of resources is a good idea.
Of course.
I think that it makes sense, but I raised an eyebrow and I sent a follow-up question and I asked, are these Toronto patients being kept in quarantine the entire time? Do they ever have any contact with the city of Ottawa? Once cleared/healed, are they then transported back to their town?
Solid question.
Our source confirmed, yes, these patients and any patients with COVID are kept in isolation. They do not have any contact to the city or individuals aside from staff in PPE. Once they're recovered and don't require ICU, they will be transferred back to Toronto or wherever they came from. We have not transferred any patients out as we just started receiving them recently and they haven't recovered yet. But I have heard from a close source that works for the local hospital with patient flow discharge planning. She said that the hospitals have been paying for transfer services back and that the hospitals get compensated by the ministry. Okay. There was a recent article released by CTV News. She shared the link that a Toronto family was left to pay for their loved one's body to be transferred back to Toronto. I'm not sure what happened there, but since we haven't been in the position to send anyone back yet from our department, I've heard the transfers back are covered at the expense of the ministry, which should be the case.
Yeah.
It's a public health,
of course,
concern. But apparently, there's one story here: Toronto family forced to pay to bring back uncle's body back after hospital transfer to Ottawa. Imagine that,
man.
Imagine that hiring a private company. The uncle had to pass away alone in another city, only for the family to have to cover the expense of bringing him back.
Oh man, and I would love to emphasize the word alone.
Alone.
Oh my God.
Nobody there. Yeah, it's so sad.
I have I'm not gonna say names, but somebody that I know and his father was in the ICU recently for COVID, and he was finally recovering, but he was so sick and tired of sitting on that bed that he just started to unplug himself. Like he just wants to get up and move because he's been sitting on that bed for like 9+ days, 10 days.
100%.
And
I
then,
totally agree with that.
And then imagine,
I don't agree with it, but I totally understand where you're coming from. Because I'm sorry, just real quick. I tried to escape the hospital when I was in ICU, which is really amazing. I don't know why I left that detail out when I was explaining it to you. My uncle caught me at the door. I had the IV. I was rolling the IV with me. I was out. I was done. Sorry, go on. Continue.
And so now imagine you knowing your father's in the ICU, you receive a phone call, or one of the family members receives a phone call from the hospital asking for permission to strap him to the bed for his own protection. So he doesn't get off the bed. Because they have to keep him monitored, right?
Right.
He can't keep getting up and stuff until they tell him to do so. But like tough times, man. Like I would
Now take that scenario that you just described and put it in another city. Imagine him going through all of that
somewhere else
and alone. Imagine not having access to your loved one.
Yep.
The person both receiving the treatment and the person related to that person that can't be with their loved one. It's crazy.
It's insanity.
It's really hard to deal with. So I'll continue on here. The hospital has also stopped doing surgeries other than emergency surgeries or C-sections to help alleviate the need for more beds, which has helped a lot. But the public wait times for hip replacement or whatever else has now increased even more. Canada healthcare system was already rated poorly because of its long wait times for healthcare services. So imagine how many years it will take us to recover from this pandemic and catch up. Bro, I never thought of that. The ripple effect of all of the procedures that are being backed up. It's going to be insane.
Now take that thought and put it towards everything else that's happening wrong in Canada. That is also going to ripple effect everywhere.
Oh, you mean like the mental health, depression, suicide,
economy-wise, everything.
Economy, businesses.
Now, of course, this is one of the most severe ones because those surgeries where you have to wait for a special doctor to be able to operate on you for whatever reason. Now there's going to be a massive lineup, twice as long. Not 100%. A lineup, a wait time.
No, I mean, I like it's true. The already when things pre-COVID, like when things were great, it was like average 6 to 8 hour wait just for an X-ray.
My cousin had acid reflux and he had to get surgery for it because it was so severe. 3 months wait. Now imagine somebody has the same issue as him, how long they're going to have to wait after COVID. That's just an example. We're talking about a time where nothing was wrong and you can go to a hospital freely and wait a normal amount of time. You know what I mean? And for special surgeries like that, where I had to take 3 months for you to actually get a spot, and that was normal, just literally process in your mind how long it's going to take in the future to go at a surgery like that.
So they continue, this pandemic has not put a strain on our healthcare system just now, but also for the years to come, and backlogged surgeries and non-urgent services. Absolutely. Never ever thought of that.
Another question we got to ask was, what impact have the variants had, and how has the hospital adapted?
Because right now we know that like the flavor of the season is external variants. North Africa, India. There's all these different variants that are now suddenly
in play.
Thing.
Yeah, they're in play now.
They're in play.
They're affecting everybody now. All right, so the variants have seemed to spread a lot faster. And we're seeing a lot more younger people with the variant requiring ventilators. I actually heard on the news a couple of days ago, maybe sometime last week, a kid and his or her mother were in the hospital for COVID, and the kid passed away.
What a nightmare!
Like I was shocked.
And that's another myth, right? That we mentioned as well in our podcast, like a couple episodes ago.
Yeah, but
where it was like the immune compromised and stuff like that. But this new variant seems to be really aggressive.
Yeah, exactly. The new variants.
Yeah.
We were talking about original COVID at that time.
That's right.
Now there's variants.
Yeah. Yeah.
So it's a completely different ballgame. Well, not really, but like a more severe ballgame.
Yeah.
These patients are getting very sick and hard to ventilate. I've obviously never seen 20, 30-year-olds this sick. It's scary. Of course, it's scary, man. This hospital had a surge plan in place and has been implementing our plans as our numbers go up within the hospitals. They have taken the same plan approach for the variants as they had planned for their pandemic in general. Our plans are based on needs of beds to meet the demands. Fitting more beds in the unit, sending more staff to help where needed, redeploying staff from the other areas, especially previously trained ICU staff. They also trained a lot of ICU staff at the beginning of the pandemic, which has helped. Solid news. Glad to hear that.
Yeah.
Especially after the first question where she's saying they had to get nurses who are not qualified for the ICU.
Just as support.
Yeah. So this is good to hear at least.
Yeah. It's like, it's one thing to receive help. It's another thing to actually receive the right kind of help that's going to actually make an impact.
Exactly. What's going to make a difference and help a lot. I'm not sure if you have been following the news on this, but the military is also being sent to Toronto to help with their ICUs. Military nurses are trained in ICU and they're using field hospitals. Nurses from home care and the communities are being deployed there, as well as nurses from the east coast of Canada have been deployed to Toronto to help. Wow. All right. So now military is involved in the whole situation as well.
Well, this isn't new. Like we talked about this last time, and we were going based off of, you know, the limited news that we had received, which was like, you know, martial law or the military suddenly, because the timing was so wrong, because our politicians had the nerve to allow the police to stop people on site
because of no other reason but COVID. And so the people were already in the mindset of domination, of government control, everything. And then they made the announcement about the military being sent to Toronto. And then people were it kind of fed that snowball where people were like, oh, so now we're going to have soldiers marching in the streets and like tanks making sure that curfew is being respected. And then it's like, no, bro, it's actual ICU. Military nurses are trained in ICU by default. That is insanity.
It's fucking awesome.
It's unbelievable.
It's fantastic.
Yeah.
Like, not only are they badass enough, right? Like just being in the military, being in the medical staff. It's like, yeah, we even got the ICU upgrade. And we got the ICU add-on. And we got the patch.
Not only that, what's also awesome is they get to work here.
Yeah.
In their hometown.
Making a difference.
Making a difference. Exactly.
1,000.
Exactly.
So yeah, and then they're you know, from the East Coast and from home cares and communities are being deployed as well. So like this is a massive effort. It's really an impressive display of like resource allocation and movement, like logistics. It's brilliant. Now we can criticize all we want. Listen, as far as I'm concerned, like I said, Frontline is talking right now. Shut the fuck up.
Literally.
Military nurses, ICU trained, East Coast help, everybody's mobilizing. This is the magic. This is the beauty. Whether you believe in this pandemic or not, we're hearing it from the front line. This is what's happening. This is what's being done. The politics, the economics, everything, all of that clownery, if you will, none of that matters in this, like in the words that I'm reading. Or from this source right now, you know, when they connected with us, I think it's fantastic. It's good, and it shows you. It's opening my eyes. I think that it has humbled me a little bit more, and to, you know, just slow it down a little bit.
And I needed that though, because I'm hearing all this new stuff from different sources that are not accurate, and it's getting to me because I know they're not accurate.
Yeah,
but this.
I'm not questioning. I'm not questioning a registered ICU nurse, bro.
Never.
No, I'm not. I'm sorry. You stand at attention. You salute. You stand up when they enter the room.
100%.
Well, I swear to God, I put them at the top of my respect food chain. Politicians at the bottom.
100%.
because they are leveraging and they're taking advantage of these heroes, as far as I'm concerned, with other hidden agendas, and political, economical resets and favoritism, corporate America, big box stores, all of that nastiness, ugliness. These guys are just trying to get enough ICU beds inside of a room, So I asked a third question. I said, is it just the elderly and immune compromised catching the virus and in need of ventilators? What are some of the common health traits that you noticed in those admitted to the hospital? And the source said, at the beginning, we never had to implement our surge plans or need extra nurses deployed for us for help. It was mostly nursing homes that were having outbreaks and deaths from COVID, which is facts.
Which is what we were saying before.
That's
too.
facts.
Yeah.
No, there's no cap there. Within the last month, with Toronto and other hospitals filling up with Toronto patients, I've seen a surge in patients, and it hasn't been just older patients. Since the surge, it's been mostly younger patients.
Wow.
Not some, mostly younger patients.
And now, I will go back to a point that I made in a previous video where, when this government is aware of a new variant, why were the borders still open?
No cap.
Like literally, because before COVID entered Canada, that's when it should have happened as well.
Do you remember the Ottawa airport? People traveling because it was around March break.
Yes.
At the beginning.
Yeah.
And the Cuba, we knew people. Remember, we knew people.
Well, we knew people that we
thought left.
Yes.
Remember, they're like, "Yo, f this, I'm going."
Yeah.
Yeah, I mean that was the flavor. That was the mindset.
Literally, and they were conversating about closing airports, but never did.
Yeah.
And here we are. And now with this new variant, I guess we haven't learned our lesson yet. We also didn't close the airports once we heard about the new variant, and now it's in Canada once again. Round 2.
Facts. Yes, we have seen some that have had conditions like diabetes, and those people are sicker with COVID, etc. Weight gain, not weight gain, sorry, obesity, and any, if you're already entering the hospital with any other health issues with COVID layered on top, you're going to have a much harder time.
Yeah.
Basically. And they have been deemed higher risk, and they did get very sick. But I've also seen young, healthy people get very sick. So this virus, and especially these variants, are definitely not discriminating. That is a big eye-opener for me personally.
Huge.
Now, what do I know? What needs to be done? Well, of course, you can't depend on the government or the media to tell you to stay healthy, vitamin D, get your sun, exercise, get your sun vitamins like your sunshine, and try to maintain your health in light of all this stuff. Practice good hygiene, social distance, 1, 2, 3, right? But you try to do all that stuff, but you also think, well, there's also some really young, healthy people that are being admitted.
Yeah.
And actually getting really, really sick.
Yep.
And like passing away.
It's not a joke, man. And I hope this is a really a big eye opener for those people who think it is. Like I never.
We never denied it.
I never denied COVID.
No.
You know what I mean? Like, I knew it existed.
Yeah, it's a real thing.
I'll admit, at one point, I never thought it was as severe as they're saying it is.
Yeah.
And I've known now a couple people who've gotten it. I know how severe it is, but at the same time, like, this is no joke.
No.
It's getting bad, man.
It is getting bad, but I think there's a light at the end of the tunnel here, which our source actually mentions a little bit later on. But then I went ahead and asked, I said, in your opinion, have the lockdowns been working? And why?
Thank you for asking that. Because I kept repeating that.
If you ask a politician, you can't trust them as far as you can throw them.
Of course, because they just repeat the same words over and over again, and we get the exact same outcome. Guess what that outcome is?
And if you ask the media, they need you to watch an ad before they answer you.
You can't skip that, huh?
You can't skip the ad.
Damn it.
You got to watch all 56 seconds. So, I mean, this is Frontline, bro. I'm like, yo, what do you think about the lockdowns? All right. So they said, as much as lockdowns have impacted people and businesses, they do help keep the numbers down. Unfortunately, though, these lockdowns have also sent us attempted suicides. Mental health has been a factor in all of this, and I think the province's decision making with lockdowns, but ultimately vaccinations will impact the numbers more. I feel mental health will be a concern post-pandemic with recovery, not just for people feeling lonely and isolated, but families losing their livelihoods, businesses, families that have lost loved ones from COVID. I worked with one patient that lost both his parents from this.
Wow.
And I've seen young patients with little kids at home super sick with this. And we're still not sure if they'll survive. And there's obviously many more stories like these. I worked with one patient that lost both of his parents from this. And I've seen young patients with little kids at home super sick. I mean, bro, like...
It's not an easy time, man.
That's hard to read.
It is hard to read.
You know, like but, my eyes are tearing up and you just... This is it, bro. This is Frontline. Like, this is ICU Frontline, bro. Like, we can't say anything.
It's not even that. It gets to a point where you have to guess if the person you're looking at is going to survive this or not. Because, like, it hasn't been studied enough to the point where you know how... If this person is going to get rid of COVID by himself or if he needs 1, 2, 3, you know what I mean? It's tough.
Yeah.
Especially when you're looking at somebody that... you birthed, that you raised, or that raised you. It's not easy, man. Not at all. And I'll go back to one of the points she made there with the whole mental health thing that we've been talking about for a while. I am glad that this person was able to confirm it for us.
Yeah, and like I said, that's the thing about Frontline. Like they call it as they see it. You know, and mental health is huge. You don't think intensive care unit deals with suicide, depression?
They deal with every single thing
drug
possible.
abuse, alcoholism. You know, like how far do you have to push your body to need an ICU because your mental state was so decayed and devastated? Like that's a real thing, and I love that she flagged that because again, just like the long list of operations and the backlog of wait times, when this is done and when everyone's vaccinated and everything seems to be okay, the mental, emotional, and psychological repercussions of this pandemic are going to ripple out for years to come. And it's going to have a huge impact on it. It's basically saying that these people, these heroes, are working their asses off right now. And when we're okay, and when we're finally able to live on our normal lives, their job has just begun. You know what I mean? I'll continue. Families struggling with kids at home while working. Families exhausting all of their vacation and sick times during COVID to care for themselves and their loved ones, and for not having any ability to take time off afterwards as their fiscal year has just begun. You only get your vacation and sick leave at the beginning of the fiscal year, bro. And people are completely exhausting them right away. That means that you have to continue on until the end of the year, until they get replenished again in the next year. Like, how devastating is that?
Like you can't even catch a break, literally.
You can't even catch a break, yeah.
Man.
Frontline staff and essential workers burning out from all of these and potentially having PTSD from everything they're seeing and experiencing. Mental health will need to be a priority in our recovery post-pandemic. Preach, no cap, 1,000%.
I mean, like...
I'm just going to say it again. Mental health needs to be a priority in our recovery post-pandemic. And I'll tell you what, not just our mental health, but frontline heroes as well.
Oh yeah, 100%. Once this is done, everybody else, no offense, don't take this the wrong way, sit on the side, and whatever the frontline workers need, they get firsthand because they deserve it. 100%.
You have to protect the people that protect you.
Of course.
You can't. As odd as it sounds,
Yeah.
you have to put them above. You have to shine your shield. You have to shine your shield. You have to sharpen your sword. Right?
Facts.
Do you feel, this is another question here, do you feel a disconnect between what people are seeing on the news, social media, and what's happening in hospitals? Yes and no. All right. So again, this is their world. Like it's they're being torn in both directions.
It depends on the situation at that point, right?
Yeah. So she says, no, I don't feel like there's a disconnect as I'm seeing doctors I work with in the media explaining what's happening, and I see the media posting our daily ICU counts. I feel the media is keeping up with case counts and trying to keep up with the reality of the situation we're in locally and provincially. Last week, they even posted pictures of the ambulance bus that's transporting multiple ICU patients from Toronto to other hospitals within the province. But on the flip side, yes, there is a disconnect with how the public is perceiving everything and these numbers. They'll say 30 patients in ICU to anyone that seems low, right? We have 200 nurses and clearly more than 30 beds in the ICU. But when we typically hold 27 patients in our ICU with a normal day-to-day accidents and other medical emergencies, and now 30 COVID patients are taking over that space too, that's a lot to add. And more coming daily from Toronto. That 30 is 30 too many. That's 30 more nurses and staff you need with the surge plan, 15 ICU nurses and 15 non-ICU nurses. But like I said, the hospital has stopped doing surgeries and other non-urgent services to help decrease the need for those beds to free up space to fit this. But people are still having strokes and heart attacks and other medical emergencies that require care. Facts.
Bro.
Where's the cap, bro?
I'm literally reading this as if...
Where's the cap?
What do you want me to say? I'm literally reading this as if this is the first time. We're back in 2020, bro. Okay? This is March. And this is the nurse explaining the very first encounter she had with COVID.
Yeah.
As a nurse.
Yeah. It's like the same thing.
Nothing has changed and it's just getting worse, bro.
Yeah. But I love the fact that not only are ICU nurses able to grasp the current situation, but they understand the big picture in terms of still caring for the people that are not related to this damn pandemic. Because they're not here for COVID. They're here for everybody. And they're being put in a position where they need to obviously, in a pandemic, prioritize their focus, their energy, their resources. But you can see over and over, you'll notice in her answers, she keeps bringing back the people that are still suffering outside of this pandemic, because that's the nature of a frontline worker.
Yeah, because everybody seems to forget about everything else.
Yeah.
And just strictly COVID is the main topic.
Which is why I went on my rant about businesses, which is why you went on your rant about the borders, which is why we in our past episodes, we're talking about the divorce rates and the alcoholism and the mental health. But you know what's funny is that we may not have that first line experience like this person does, but they're actually flagging all the things that we talked about also, such as mental health. And they're going to get in, this person talks about the border and the lockdowns in a little bit. But it's funny because like the narrative meets, but I think where I need to adjust is just really understanding the nature of this beast, of this virus, respecting it, and understanding the people that are willing to be in front of it.
Yeah. I would absolutely hate to hear, but would understand if one of these ICU nurses are suffering from mental health.
Oh, you can guarantee it.
Oh, bro.
You can guarantee they are.
At that point, like that's just you deserve everything and more.
Well, right. You deserve everything and more, but anyways, I don't want to open up that topic in terms of them, because then I thought about how they treat the military when they come back, and how we take care of the people. I'm not sure. I just don't have the information, but you would hope, like you said, that they're taken care of.
I hope so.
Yeah.
They better be.
So I'll continue. And again, Toronto's increased case counts needing ICU has not started to decrease, meaning as their counts for ICU increases, all other ICU beds in the province will increase too. Lastly, if we didn't take any measures to help decrease the spread of this virus with lockdowns and closures, and other cities start to get impacted with increased counts like Toronto did, then our healthcare system and ICUs will be even more overwhelmed.
Hear that, Toronto? Are we gonna still stay on the streets and protest, or are we gonna go home and just?
There's nothing. I talk about the protest section a little bit, but I don't think this is fueled by the protests. But I feel like I was talking about the lockdowns, But I think it's more like the parties and people not taking precautions. And one thing that this person mentioned also was a lot of patients come from multi-generational homes. All right. So you think about a home that has your grandpa, your grandma, your mom, your dad, you, and if you have kids, your babies living in it. It's a very cultural thing. In the Arab culture, in the Asian culture, Southeast Asian, the Indian, Pakistani cultures, families always live in the same building or home.
The reason why I mentioned the protest was because every single one of those people in the protest are not wearing a mask.
Right.
Very close contact.
It's because they're protesting.
I know they're protesting, of course. They're protesting against the masks. But then it's very ironic. You're in a pandemic.
Yeah.
You need that mask.
Yeah. No, I understand. I totally get it. I totally understand. But the point that this person was making with the multi-generational comment was that people are still going to work.
Of course.
Coming back home and spreading it because they don't have sick days. They can't take time off of work. They can't afford it.
Not even that. Well, that's a fact, of course. But you might be asymptomatic. You might feel symptoms after 3 days.
Yep.
You don't know.
Facts. So I'll continue. Outside our staff lounge, every few days, management posts updates. A couple of days ago, they posted vaccination update on how more people that get vaccinated, the more we will see a decrease in hospitalization and case counts, obviously, right? But it's a light at the end of the tunnel. So vaccination tracker here in this image, April 27th. Canada, we're looking at a 29% population at least with one dose. Ontario, 33% population, at least one dose. We need more than 40% required to start seeing a decrease. So we're at 29 Canada-wide. We're at 33 Ontario-wide. We need to get to 40, basically, is what they're saying. Now you talk about the vaccine and the safety and the...
That's the thing. Like if a person like this person goes and tells me, you need to take the vaccine, I would want to take the vaccine. But at the same time, I wouldn't want to take the vaccine because of just the aftermath, the side effects that are unknown, the whole nine.
Yeah. So this ICU frontline worker is describing what would help alleviate their situation.
Of course.
And it's the vaccine.
Yeah.
That's the only conceivable thing. Lockdowns, hygiene, social distance, and all of those safety precautions, sure, they help. But medically speaking, in her world, it's just the vaccine that's going to help.
I at this point, I understand. I know it's just the vaccine that's going to help.
Yeah.
Another question we got to ask was, how long do you think this pandemic will go on? I would love to get an answer. Here we go. Until the majority of people are vaccinated. Hard to say, but public health has hired a lot of staff and really boosted their vaccination efforts. At this point, it will rely heavily on actually getting the shipment of vaccines. If I had to give a date, I am praying we have loosened restrictions this summer and everything opened up by fall. Please.
That sounds great to me.
Please.
I don't mind that.
I will do a backflip. I'll land on my neck, but I will do it just because I will be free.
Straight up. Straight up.
Continuing. But I feel like it won't be fully over until next year, after everyone's received their booster vaccine if needed, and it becomes added to their annual flu shot. Post-pandemic recovery will take years for businesses, healthcare services,
Big facts.
etc.
Yeah, so like just for all the reasons that they outlined already, you know, the recovery I think is going to be the next topic of conversation. But bro, if the industry has time to adequately test the vaccine and you roll it into the flu shot and it's just as safe as the flu shot, and the blood clots and the deaths and all of the craziness that we're hearing about, that starts to decrease or completely go away, great. I'm all for it. Let's do it. Where do I sign up? You know, but that's later on down the road. Like I'm kind of like you, like I'm 50-50 on the whole issue.
This nurse said that we're going to have a lot of mental health cases after the pandemic. I'll just add drugs abuse to that, alcoholism, all this stuff, stress, whatever you want. But then you want to tell me take the vaccine. I mean, I would love to, but we still don't know what the side effects are. That's my issue. Mm-hmm. We know what's going to happen after COVID, mental health cases and all that stuff. We don't know what's going to happen with the vaccine. So it's like mixed emotions at this point.
Right, but the only, like I said, the only conceivable solution in her world is the vaccine.
And I understand that 100%.
So there's a balancing act between public satisfaction and the medical need to reduce,
of course,
the crisis.
It's a risk. Right? Somebody
it's
like you have to take a risk.
Exactly. It's risk assessment. It's risk management. It's like, but bro, then, you gotta make a judgment call, even if it's 51-49.
But for those people who have already heart problems, who have asthma, who have diabetes, and there's this vaccine that's supposed to cure you, but actually makes you sick in ways you don't know.
Right.
Like, what will that do?
Well, here's what they said, because we had an offline conversation, and I had brought that point up, and they said, listen, just think of it this way. The odds of you catching COVID and being seriously ill and affected by it are still higher than the odds of you having a negative experience with the vaccine. So long as those are the odds, right? Those are the cards you were dealt. You need to make a decision based off of those odds. If the contraction rate is low, and we have herd immunity, and it's not really a necessity for you to get the vaccine, the odds of you catching COVID, habibi, they're 17% now, let's say, for example.
Okay.
But the odds of you getting a problem with the vaccine is 33%. Okay, well, cool. I'll wait. I'm good. But right now, it's just not the case.
As low as that percentage is, it's the outcome that's scary.
Like the future, the long term?
The long term, exactly.
Yeah.
So my thing is, okay, I'll just give you an example. You have 3% chance that you'll get blood clot from one of the vaccines. But you don't know if that blood clot is going to kill you or not.
Right. But you don't know if COVID's going to kill you or not either.
Yeah, but I'm not planning on getting COVID. It might just happen by itself, but I will plan on getting the vaccine if I wanted to.
Right.
That's my choice.
But then it's the odds again of, what are the odds of you catching COVID?
Very low.
Well, we don't know that, because right now it seems to be not the case. I mean, for Frontline, it's not a moral dilemma.
Of course.
It's a medical one.
Yeah.
So you're talking about your moral dilemma, and you gotta have to make a judgment call based off of, well, if it's me choosing or if it's something that happens to me, it's almost like you're willing to let fate run its course. And if you caught it, then you're you can accept the fact that you caught it because it was out of your control.
Of course.
Right. For them, it's like, we can't leave it up to fate. Our ICUs are getting slammed right now. And right now, the only foreseeable solution is the vaccine.
But what happens when the ICUs get slammed with patients who are suffering from the vaccine itself?
Oh, that's a different story, which we're not at.
Which we're not at yet.
There. We're not there.
But
Yeah.
there's a chance that will happen.
I guess.
I don't know what
Yeah.
percentage of that chance will be or is, but there is a chance that will happen. But then
that would
again,
be something else.
but then again, this is coming from a person who is fed up, who has worked for over a year with COVID patients, who just wants this to end. And I understand 1,000,000% their side and their perspective of why we should take the vaccine. But then there's just it's just my opinion.
Yeah, and I think that's right. You're just you're showing a good example of the tension. It's a tug of war. Like I said, public comfort and medical necessity. Like, you know. But then I said, well, I opened it up at the end. I said, is there anything else that you wanted to mention? And in capital letters, they said, yes. I hope that after this pandemic, all levels of government come together to find a way to all work together, not just for future pandemics, but for all decision making. It needs to learn to work together, it being the government.
Beautiful.
For me and a lot of frontline staff, this has been the most frustrating time to watch. We can't have local and provincial lockdowns, but keep borders open. Keep borders open.
Thank you. This
so.
is what I'm saying, bro.
Bro, this is straight from the.
Oh my God!
Straight from Omaha Beach.
Holy!
This is straight from the front.
How many
line.
times do I have to repeat that same statement? If we're in lockdown, lock it down.
We've had numerous patients and still have that have caught this from travel. Even with lockdowns, people were just leaving the city and flying somewhere nice. People are thinking if they isolate somewhere else, it'll be fine and end up bringing it back. Hence all the variants that's causing the third wave. Showing proof of a negative result within 72 hours is not enough. We all know, as well as CDC and WHO recommendations, require you to isolate for about 2 weeks post-exposure, as you can be asymptomatic or have a negative test immediately after exposure, then test positive days later. So the fact that Canada is mandating this test for up to 72 hours before a flight, or making you isolate for 3 days in a hotel or home after travel, is not enough in caps. That's in caps, but it's no cap.
All facts, no caps. All caps, no facts. Whichever one you want.
Preachy. It's a joke. Follow the science. If we can't afford to hold everyone in a mandatory hotel for 2 weeks post-travel, like Australia did from the very beginning of this, and they're back to normal life now with very minimal cases. Shout out to Australia, man. Aussie, Aussie, Aussie. Oi, oi, oi. Then shut it all down to non-essential travel. Now, as a side conversation, I had a follow-up question. So I said, hey, so you're saying that this isn't enough, while many people are saying that it's too much and violates their rights. What are your thoughts on protests or general herd immunity? Because some people are saying, hey, listen, you're not making me do anything after I travel. All right? I have my rights, legal and all this stuff. So again, it's medical necessity versus public comfort and / now with this new topic, legal duty or your civic rights.
Yep.
So this person said, no, I don't feel it's enough. And I feel while some people may isolate and follow public health guidelines post-travel, I still think some don't. And it only takes one person to spread the virus to others. While I understand how other people may see this as a violation of their rights, I feel this is done more to help protect the health of our people. Canada and public health has discouraged travel. And if people feel like they need to travel and they need to do, and they need to, then they need to understand that's what it means to travel right now. Requiring to isolate to help prevent this dangerous virus from spreading and killing more people. I don't see a problem with a peaceful protest, but I don't feel this subject requires that. Health and safety is our priority. While I understand herd immunity, I feel it's too much of a risk with too many potential deaths to take this approach with this virus.
Facts. I agree 100%, man. It's a huge risk. You can't like, I understand everybody else's point of view of being sick and tired of being locked up at home, but you going out and protesting without a mask around.
But sorry, I know what you're going to say, but real quick, this is why we need frontline staff as part of a governance committee.
Yes.
As part of the decision-making process. And they may be, I'm not sure, I don't think so, but the politicians need to be held accountable by the frontline staff. Like a third-party neutral.
Neutral grounds.
They're not. They don't care about elections.
No bias.
They don't care about anything. Yeah, their only bias is for public safety. You should be biased for public safety and
facts
and science.
I agree.
I'm sorry I cut you off. I just
no. My point was
my mouth just.
I agree with her because like do you want to protest against wearing a mask? Do so by wearing a mask. It's ironic, but like at this point, like her point is you're in close contact with the person next to you. You don't know who that person is.
Straight up.
You know if he picked his nose and flicked it on the ground. You know if he licked his finger or whatever, shoved it up his bum. Who knows?
It's not even and
you don't know where his.
I've been on public transportation before, and I've seen people do things subconsciously. You sneeze, or you wipe your nose, or you rub your eye. It's so subconscious. You pick your ear. Like sometimes people don't even notice.
Bro, I saw a guy at a grocery store take his mask down to sneeze in his arm.
Amazing.
Bro. Like
it's like filling your gas up. It's like filling your car up with gas and then pushing it.
Oh my God.
I feel that. All right. Overall, Canada is very slow to respond. They shut it all down at the beginning, but then after reopening its borders, it hadn't closed it down again after seeing Ontario's numbers and variant count rise. I think land borders are still only open to essential travel, but flights are open to everyone.
Stupid. What's the point?
Another example of needing the provincial and federal government to learn to work together is paid sick days. Big facts. If healthcare workers are telling you this may help keep people home when they're sick and decrease the transmission, then that needs to be a priority. A little bit louder for the people in the back. A little bit louder.
I am glad that I think like them.
I love the fact
that I'm so proud of myself.
Straight up. No, man. We're with the front line. We're with the
Oh
front line.
my God.
Absolutely. It seems as though shutting it down doesn't cost them anything, but paying out sick days costs them too much. So no one wants to pay it out of their budget. Damn, smoking gun.
Damn.
Smoking gun right there. That's the ace in the pocket. That's the ace in the pocket right there.
Diggity dog.
Let's all remember that if numbers continue to rise, the healthcare budget will go up, and that'll be costly for the province anyway. It's a lose-lose.
Like, I know. And then, so why don't you do it for the people?
Big shout out to our ICU nurse, this frontline worker that connected with us and really took the time as a real cousin to answer our questions and to really give us just a small dose, opened the window into their world a little bit.
Thank you so much.
Thank you for your service. Thank you for your time. Thank you for your dedication. Thank you for being there and giving us that peace of mind that if me or anybody in my family needs you, that you will be there with no strings attached in the most selfless way possible. It is truly a godsend. It is an amazing thing to know that the frontline workers are there and they are tireless in their pursuit of public health and well-being. It is fantastic. Honestly.
Thank you so much once again. Bottom of my heart. Big thank you as he was about to say, I'm going to cut him off. Big thank you to the nurses. Big thank you to you for watching.
Yeah. And listening.
And listening.
If you're watching us on YouTube, big shout out to you guys. Leave a comment down below. Let us know. Give a message to your frontline staff and shout them out. They deserve it. They are our shields. We need to polish them. They are our swords. We need to sharpen them. And they are our hearts. We need to keep them healthy. So, and if you're listening to this, guys, big shout out to you. Thank you for your support. Instagram, TikTok, @CoolCousins. We may actually have some more follow-up questions. If you do, go ahead and hit us up on any of our socials. We're going to probably have more follow-up questions with this source of ours, this registered nurse from the intensive care unit. It was amazing.
Unbelievable.
Yeah.
Unbelievable.
All right. It's the Cool Cousins.
You can talk to us more than you can talk to your parents. But do let them know about this episode because this is pure facts.
And no caps at all. I don't see any. Except that one that Ibby's wearing.
Shit.